I was always the one who tripped and fell.
I started falling.
The interactions at school has been hard.
Very difficult to walk.
And my feet started to become misshapen.
More prone to dropping things.
I was always the one that was picked last for the ball game.
Painful procedures.
We struggled trying to afford the braces.
My CMT makes it difficult for me to enjoy my life in front of me.
I live fearful of what's in store for me, wondering what part of my body will break down and how quickly.
We have a sense of urgency. We want to move fast, but we want to be precise.
The time is now, the time is right.
We are on the cusp of a bunch of major breakthroughs.
So we want to be able to get these researchers their money to do the work that they need to quickly.
The campaign is called Velocity because we don't have time to waste.
I love the word velocity. You have a focused endpoint and you're in motion already.
We've been, really blessed to have a lot of the progress that's happened in CMT research, and we think that we're at this pivotal point where treatments are right there on the horizon.
We are competing against the progress that this disease is making in people that we love.
We are mobilizing the globe, the world, to help us solve this problem. The science is progressing today at a pace faster than ever.
There are 4 pillars in our Velocity campaign. The first one is to fast-track therapeutics for patients.
One of the things we've developed is a proprietary mechanism whereby we actually rank certain projects, we prioritize projects, we sequence projects with those projects that have the most chance of success.
And that's going to ensure that CMTRF invests our donors' dollars in scientific research that's going to have the best outcomes.
Second, we want to remove the delivery roadblocks.
It's well known that the peripheral nervous system has this challenge of getting drugs delivered to it. And that's going to be a challenge across all CMT subtypes, so that's why it's such an important one for us to really invest a lot of resources into.
Third, we have partners that already achieved milestones, so we want to leverage those partnerships.
So we want to be able to leverage those actual experts and bring them to CMT, but also leverage some of the technologies.
We're going to reach out to other disease industries to find out who's doing the best work with the best practices, and we're going to bring those practices to work at CMTRF.
Finally, growing regenerative revenue will allow us to create a sustainable model so we can continue to do this work.
When there is success, this venture philanthropy model returns money into the foundation that goes back into the hopper and that can, fuel the next generation.
Every project we invest in has the opportunity to grow and regenerate more research.
So if you want to end the suffering, if you want to end the progression, if you want to end the chronic fatigue and the chronic pain, that's possible. And it's possible through the work that Velocity will fund.
They're struggling every single day through their whole life. And if we can do something to help them and resolve that disease, why wouldn't we?
This really is a disease that can be completely eradicated with time and pressure.
I like to say that hope is not a strategy. But if you have a strategy, that gives you hope. This Velocity campaign is a strategy.
Give today, be the breakthrough, end CMT.